Welcome to our meeting today. My name is Erica Leonard. I'm a caseworker working with an elderly woman from an independent living facility. Her name is Georgia. She's incapacitated at the moment, so I'm just going to talk about some things that have been going on. Recently, the staff members have noticed that Georgia has been missing the noon meal. Often on one occasion, she even left her front door open. Her physical health is good. She takes medication for high blood pressure, moderate arthritis. Her family lives about an hour away, and she does get visitors on the weekend. At one point, though, Georgia called her grandson Jack by his father's name, David. Georgia seems to display some mild cognitive impairment. I've chosen dementia today because I think some of the symptoms she's displaying could be maybe dementia developing, which could happen later on. Signs and symptoms of dementia can include cognitive and behavioral symptoms that either the patient or caregiver has noticed. She's been missing her noon meal pretty often, leaving her front door open. This suggests her ability to function doing normal activities is declining. Georgia shows a lack of judgment and reasoning and not remembering to shut her front door. Some of her behavior is changing because she's forgetting to go to lunch. Her family lives about an hour away, and so she could be somewhat socially isolated, and that sometimes is a precursor to dementia. And another symptom she's displayed is visuospatial abilities, in that she called her grandson Jack by his father's name, David. She may have misspoke, or maybe she really did see David instead of Jack. This could suggest a delusion or hallucination, which is pretty common with dementia. So far, her symptoms seem to be mild cognitive impairment, but should be monitored closely to ensure her safety and mental health. If she's leaving the front door open, she may not be able to be left unattended, might need to transition to a long-term care facility or have a caregiver with her at all times. We want to make sure that she's socializing to avoid furthering any anxiety or depression. I don't suggest any medications at this time. We can send a referral to a medical doctor, maybe for a possible MRI to take a deeper look at her brain activity. A discussion should be made with the family of how they want to approach some of these behavioral emotional therapies and what if her neurocognitive decline continues. Would a family member rather be a caregiver rather than putting her in long-term care? Some other approaches we can use are lists, calendars, signs with her name on her door, phone lists, and labels for objects can help. Also, behavioral activation, which is a psychotherapy used to engage activities and help with depression. Also, problem-solving skills for memory would be crossword puzzles, reading, even brain games. She should maybe do some chair yoga or walking, because some of these things can actually help reduce the uptake of dementia symptoms coming on. So thank you very much.